in orthopedics, you have to know a few eponyms like the Brody's abscess. What is that? Brody's abscess. It is basically a subacute osteomyelitis of the upper tibia. It's called the Brody's abscess. Then what do you call as Terry Thomas sign? Terry Thomas sign is a scaphoid lunate dislocation. You see it in scaphoid lunate dislocation. What is Bankat's lesion? This is easy. Bankat's lesion is an anterior glenoid labrum tear or labrum lesion. That is the Bankat's lesion. Then you have to know about Hill-Sachs lesion. Hill-Sachs lesion, it is basically at the humerus head. Right? So this is what is regarding the few eponyms. Other eponyms include the tennis elbow. Tennis elbow means it is a lateral epicondylitis. It is a lateral epicondylitis. What is a medial epicondylitis called? Medial epicondylitis is called as the golfer's elbow. Then what do you call as what do you call oligron bursitis as? Oligron bursitis. It is called as the student's elbow because usually students flex their hand and rest it on the bench, and they do it for a long time. That leads to oligron bursitis. Then what do you call as housemaid's knee? Housemaid's knee, it is prepatellar bursitis. Prepatellar bursitis. What is clergyman's knee? It is infrapatellar bursitis. These are the eponyms that we have to know in orthopedics. Then coming to few X-ray features. When you have a sun ray appearance in the X-ray, the possibility of osteosarcoma is there. When you have this soap bubble appearance, then the possibility of giant cell tumor is more than adamantinoma. Right? Then onion peel appearance can be seen with Ewing sarcoma. These are the X-ray findings that will give us a hint about the problem with the bone that helps in diagnosing the disease. Depending on this X-ray feature, we post the patient for biopsy and proceed further. Then coming to few fractures, which is the most common bone to get fractured at birth? Most common bone to get fractured at birth is the clavicle. Next, most common, am I audible?
Yes, ma'am.
Most common carpal bone to get fractured is the scaphoid. Then most common bone to get fractured in the face, it is the nasal bone. Right? Then what do you call it as stress fracture? Stress fracture or march fast fracture. March fast fracture. It is the second metatarsal neck fracture. It is the second metatarsal neck fracture that is called as the stress fracture. right? If there is a fracture, then there is a chances of injury of the nerves around them. Which is the most common nerve to be injured in a humerus fracture? It is the radial nerve. In case of a supracondylar humerus fracture, anterior interosseous nerve is injured more chances than the median nerve. Then, whenever there is a hip fracture, chances of sciatic nerve injury is there. Whenever there is a knee fracture, the chances of common peroneal nerve injury is there. Whenever there is a fracture in the elbow region, the chances of ulnar fracture is there. I think I made a mistake. These are all fractures, and this is dislocation. Whenever there is a dislocation, it will be a sciatic nerve injury is expected. Knee dislocation, common peroneal nerve injury, elbow dislocation, ulnar nerve injury. Whenever there is a wrist dislocation, there are chances of median nerve injury to be there. Speaking about dislocation, which is the most common dislocation seen in the body? Most commonly dislocated will be the shoulder, and in that shoulder it will be anterior dislocation will be the most common. Whereas in case this is for adult, in case of a child, the most common dislocation would be in the elbows, right? Whenever we have a fracture, the fracture can either heal normally or it can heal with a malunion or a non-union. The fractures which end up healing, more chances of having a malunion. Malunion means abnormal union between the two fracture fragments. Malunion is the supracondylar humerus fracture. Then IT fracture in the intertrochanteric fracture of the femur, clavicle fracture, and the Colles fracture. These are the possibilities of having malunion. Whereas there are fractures which causes non-union. So whenever you operate on these fractures, you usually keep bone graft in that area so that there is no non-union that is formed. Lateral condyle humerus fracture. Neck of femur fracture. Then the scaphoid fracture. Then the fracture of tibia, ulna, talus. All these fractures will lead to non-union. Right? Then coming to individual things that you have to know in case of fractures. Speaking about the neck of femur fracture, there are many varieties that can happen. One is a subcapital. Subcapital, there will be a fracture between the femur head and the neck. Then transcervical, where you have the mid portion of the femoral neck that is fractured. Then the basicervical, which involves the base of the femoral neck problem, fractured. So obviously the treatment would be surgery, no wonder. In case of a person who is less than 65 years, you usually go for a dynamic hip screw fixation, DHS. Go for a dynamic hip screw, whereas a person who is more than 65 years, you have to go for a hip replacement, hemiarthroplasty. Either hemiarthroplasty means you replace only the femur component of the hip joint. That is hemiarthroplasty. If needed, you might go for a full arthroplasty of the hip, where the entire hip joint along with the socket and the femur component is changed into a metallic component. That time it is called as arthroplasty. So more than 65 years, either hemiarthroplasty or arthroplasty is preferred, right? Then regarding the supracondylar humerus fracture, this can supracondylar humerus fracture, if it is not treated properly, it can end up into a gun stock deformity. The person's hand can come like this. It will be like a gun stock. Gun will be like this, right? Old age guns. So the hand can become like this. It is a gun stock deformity. The supracondylar fracture has a common incidence of gun stock deformity, and hence it has to be treated properly with either a K-wire or a nail, depending upon the type of fracture. They designed on the type of treatment. Then coming to few casts that we use. Before casts, we'll just go into the nerve injuries. I already told you the common nerve injuries about the fractures and dislocation. If it's a nerve injury, how can the nerve injury present? It can either present as an axonotomesis, or it can present as a neuropraxia, or it can present as neurotemesis. An axonotomesis, it is just an anatomical damage. And there is a progressive tinal signs will be seen. That is because of the myelination. Progressive myelination, it will cause the progressive tinal sign. The numbness in the area of growth will be seen. Neuropraxia, it is because of a physiological block of the nerve. Here there will be a recovery is possible in both axonotomesis and neuropraxia. Whereas when there is a neurotemesis, means there is a complete nerve transection. So after this, even the tinal signs, myelination will not be complete here. So there will be static tinal signs. You will not have that numbness beyond the cut area. So this patients, we don't know about the recovery. The patient might or may not recover fully with the same same things as before. Same finger sensory and motor movements as before. Then coming to few casts that we use. Broomstick cast, where it is used for. Broomstick cast is used for Perthes disease. Police cast, of course, as the name suggests, it's used for the police fracture. Cylindrical cast, cylinder cast, it is used for the patella fracture. Frog leg cast, it is used for the congenital dislocation of hip. Glass holding cast, it is used for the fracture of the scaphoid. Spica, it is used for the fracture femur in the children, babies especially. Then Minerva cast, it is used in cervical spine disease. Then patellar tendon bearing cast, it is used for the fracture of the tibia. Then turnbuckle cast, is used in scoliosis. Then the U slab or a honey cast. It is used for the fracture of the humerus. Right? These are the casts that are most commonly used. Then coming to the nerve injuries, to complete the nerve injuries, we we already, while checking for, in anatomy, we discussed about the ulnar nerve, median nerve, how to check and all those things. Just in a repetition, if there is an injury of the radial nerve, what will be the presentation of the patient? Patient will present with the wrist drop. If there is an injury of the posterior interosseous nerve, the person will present with the finger drop. If there is an injury of the sciatic as well as the common peroneal nerve palsy, the person will present with the foot drop. If it's a radial, we discussed median. If it's a median nerve injury, the person will present with a carpal tunnel syndrome. Ulnar nerve injury, the person will present with the claw hands. Right? Then lower limb, this lateral cutaneous nerve injury. Lateral cutaneous nerve injury. The patient will present with meralgia paresthetica. Only that particular part will have a sensory deficit, that is meralgia paresthetica. Then you have to know the difference between Erb's palsy and the Klumsky's palsy. Right here, C5 and C6 will be lost, whereas in Klumpke, C8 to T1 will be affected. Upper arm will be involved in Erb's, whereas lower arm will be involved in the Klumpke's. This situation usually present and the hand will be like this. Like a policeman getting a tip. Policeman tip appearance. Right? This will be regarding the Erb's palsy. Whereas in case of Klumsky's, since the C8 to T1 will be involved, the ulnar will be involved, and sometimes there is also a possibility of Horner syndrome to be present in this patient. Sometimes there is a possibility of Horner syndrome to be present in this patient because of the cervical sympathetic nerve injury that can accompany the Klumpke's palsy, which affects the C8 to T1. In case of this nerve injuries, there are a particular cast that helps in recovering the nerve injury. Say, for example, if it's what brachial plexus injury, means you have to put them in an aeroplane cast or aeroplane splint. I will say splint. If you want a finger immobilization, then you have to put an aluminum splint for the patient. If it's a radial nerve injury, then you have to put the patient on a cock-up splint. Congenital taloequinovarus, you put them on Dennis Brown splint. Then sciatic nerve injury, foot drop will be there, so foot drop splint. You can say like that. Whenever there is an ulnar nerve injury, lumbricals will be affected, right? So knuckle bender splint. Whenever there is an axillary nerve injury, you put them on a shoulder abduction splint. And the most commonly used will be for the fracture of femur. For temporary stabilization, we use the Thomas splint. Other splint for fracture femur will be the buckler, brawn, splint. Then congenital dysplasia of hip. Splint used will be the Von Rosen splint. These are the things that you have to know for your examination. Then coming to few diseases that we have to know in orthopedics includes the Paget's disease, osteoarthritis, osteoporosis, CTV, and all those things. First, we'll do CTV, congenital taloequinovarus. It is commonly called as the clubfoot. It is a condition where a child presents with either one foot or both the foot is pointed downwards and inwards. Two types of CTV are there. One is the postural CTV, where you have a muscle imbalance. Whereas a structural CTV will have, it involves the bones and the joints. Right? Usually, how do you treat the CTV? You treat it at birth by a cast. In 1 to 3 years, you do a soft tissue release. And more than 10 years of age, you go for a triple arthrodesis to repair the ankle joint. So this is how you treat a CTV. Then coming to osteoarthritis. Usually, osteoarthritis is the involvement of inflammatory disorder. If it's a young patient, you treat the patient with a high tibial osteotomy. ONE, osteoarthritis of the knee. If it's an old patient, you go for a total knee replacement. Right? Then osteoporosis. Osteoporosis, it is basically the breakdown of the muscle matrix, right? Most common fracture that you have in an osteoporosis condition will be the vertebral fracture. And here there will be an elevated bone alkaline phosphatase. And of course, after destruction, there will be a decreased bone mass will be there. Whereas and also if you see this drugs which increase the osteoporosis, the drugs which can cause osteoporosis includes warfarin, lithium, proton pump inhibitors, and glucocorticoids. These are the drugs which can increase the chances of osteoporosis in especially in a female. Then Paget's disease. Basically, it is a pre-malignant condition. Pre-malignant condition of an osteosarcoma. And there will be an increased alkaline phosphatase, increased calcium, as well as the increased phosphate in these patients, and the patients will have an cotton wool skull. Cotton wool skull appearance will be the one, and the patient will present with a restless pelvic pain. Restless pelvic pain will always be there for this patient, and you have to treat these patients with calcitonin and bisphosphonates, which helps in restoring the calcium inside the bone. Then coming to osteopetrosis. Osteopetrosis is a metabolic bone disorder which is caused by a defective osteoclasts. There is defective osteoclast, it will resorb the immature bones in the too much of resorption will be there, and it causes pancytopenia. And hepatosplenomegaly could be present in these patients. This is what is regarding osteopetrosis. Then you have to know about this achondroplasia. Achondroplasia, it is basically the person will be dwarf. Dwarf limb will be present there, but the IQ will be normal, and they have a starfish hand. Starfish hand appearance will be there for achondroplastia. And we know it is a disorder of bone growth that prevents the changing of the cartilage into a bone. Right? It prevents the changing of cartilage into a bone. And so it is a defect of an enchondral ossification. It is a defect of enchondral ossification. Right? Then one MCQ in where do you see bone and bone appearance? Where do you see bone and bone appearance? Bone and bone appearance is seen in case of osteopetrosis and sickle cell anemia. It's an MCQ. Bone and bone appearance will be seen in osteopetrosis and sickle cell anemia. So this is very, very important. Then you have to know about the myositis ossificans. This myositis ossificans, this happens because of too much of massage to the particular area. History of massage will be there, and this patient will present with calcification around the joints. In case of an acute presentation, you treat it by immobilization. If it's there for more than 1 year, then you have to proceed with surgery for the treatment of myositis ossificans. Then coming to compartment syndrome. Compartment syndrome is mainly because of the application of too much of tight cast. Tight cast application will lead to a vascular and nerve compromise, mainly vascular compromise. So anyway, that's why whenever you apply cap, you put a slit and see the pulse of the respective limb. If this is present, then it's good. If there is a vascular compromise, you have to check the pain on passive stretch. If it is present, then confirm the particular limb is going for a compartment syndrome, and the treatment would be, if it's in the earlier stage, you remove the cast. If it's in the later stage, you have to go for a fasciotomy to release the pressures inside the compartment so that vascular supply is good for the particular area to get healed properly. Okay. Then Perthes disease. Perthes disease is a rare childhood condition that affects the hip. It occurs when there is a blood supply to the head, femur head is affected. Avascular necrosis of the femur head happens. Avascular necrosis of the femur head happens. Here the patient usually presents with pain in hip that is radiating to the knees. Earliest change is discovered with a bone scan, and later you discover with an MRI. Right? And the treatment for Perthes disease would be a total hip replacement. Then I think that's all regarding the diseases. Named fractures, there are so many named fractures from head to toe. You have to read those named fractures. Osteotomies alone, I'll tell you name of the osteotomies and where is it used for. Chevron's osteotomy. Okay, Dwyer's osteotomy, where is it used for? It is used for the treatment of congenital taloequinovirus. French osteotomy, it is used for the correction of cubitus virus. High tibial osteotomy, it is used for the OA. McMurray's osteotomy, it is used for the neck of femur fracture. Howell's osteotomy, it is used for the OA hip. Sandwich osteotomy, it is used just for slipped epiphysis. Then Wilson's osteotomy, it is used for congenital coxa vara. Right? These will be the osteotomies that we use. Smith-Peterson osteotomy, it is used for ankylosing spondylitis treatment. So this is what is regarding the osteotomies. Then coming to the final topic of orthopedics, it is the tumors. Most common bone malignancy. Be the secondaries. Okay, that is the metastasis. Most common primary bone malignancy. Most common primary bone malignancy will be multiple myeloma. Most common site for a bone metastasis to happen would be vertebrae. Then most common benign bone tumor. Most common benign bone tumor will be osteochondroma. Okay, then most common primary malignancy of long bone will be osteosarcoma. Then the last most common benign tumor of hand. Most common benign or tumor of hand will be enchondroma. Right? This will be the MCQs that is regarded in regard to the tumors of the bone. So that is what these are the important things in orthopedics that you have to know for your examination. So I'm finishing my orthopedics